Welcome to this tutorial about how to use the Sooma web portal for clinicians for monitoring and creating treatments for the patients that are using the Sooma TDCS device at home, self-administering the treatment. So here at the front page, the login page, you can either register for an account if you don't have one, or you can just log in using the credentials that you registered with. So I'm just going to log in here to my account. And the basic setup of the screen is that in the left sidebar, you have the patients that you are connected to. So I can select any patient and then that patient's data will crop up here at the right or in the middle of the screen. And you can also invite additional patients here via email, phone, or patient ID. The recommended approach here is to, when the patient visits you, to learn how to use the device and then leave with the device, take the device with them, that you set it all up at that point, tell the patient how to download the app, and then you send an invitation to the patient so that they can accept that invitation on the spot with you, so that you can confirm that you are connected and you can create the treatment. And we have a separate tutorial for how to use the app, so you can see there how a patient can accept invitations or even send you an invitation to connect. All right, so let's have a look at this patient that I have selected here. So here we see the current treatment schedule that the patient is on, and the blue circles indicate that these are days when there is a treatment planned, and the check marks indicate that the patient has marked these sessions as completed. And if there were to be any crosses here, that would indicate that the patient missed that treatment. So for example, if Wednesday or Tuesday would be a cross, then that day that patient would not have marked the treatment as completed. And as a clinician, I can view and edit the complete treatment. Here you can see the treatment. So it's a standard protocol. It's 5 sessions per week. And then there are follow-up sessions once per week, 4 of them. And you can see that in this calendar view as well. And you can edit the treatment, and this is the exact same procedure that you'll do when you first connect with a patient and create their initial schedule. You basically select a start date. So I can select, let's say, Monday the 27th. And I can select the acute treatment period length. So that is for how many weeks will the patient do 5 treatment sessions per week. And I'll actually do a long one, so it's 4 weeks. And I'll keep 4 follow-up treatments here, but I want to do 2 of them per week. And I will start 2 weeks after the end of the acute treatment phase. So now we can see the preview here. It starts on Monday the 27th and runs for 4 full weeks with 5 treatments per week. And then a couple of weeks later, we have 2 follow-up sessions on the 3rd and the 4th and the 10th and the 11th of April. So I can save these changes or I can cancel. I'm going to cancel in this case and keep the current schedule. So one more thing that I can do here is that I can see what the patient has logged for mood, appetite, sleep, and activity. So here you can see the date range that I have selected. Since I haven't yet collected a lot of data for this patient account, I will reduce the date range from the 20th of February to the 23rd of February. Actually, the 21st. And then I can select to show the mood chart. So here you can see we have just 3 data points so far, but of course as you go along in the treatment you can start to see trends and how your patients are, whether they are responding to the treatment or not, based on these VAS scale variables that the patient enters in their mobile app after completing treatments, and even on days without a treatment. So I can here select which variables I want to show. If I want to show several, mood and appetite are now shown, sleep, activity, and I can also toggle all of them on or off. And here below I can see all the records and also whether if the patient has written any notes. Feeling good today. So that's great. Good data here. And of course you can use this when you get more data and you get more patients, you can use this to make inferences about what kinds of patients respond best and what kinds of treatments seem to work best for certain kinds of patients. So this is a really helpful tool for you as a clinician in that sense. And obviously, if the patient starts missing treatments, I think that this patient here is another one that actually it's not. Let's have a look. Here we have a patient that has been missing treatments. So you can see the crosses here, and when you start to see these things happening, then that might be a good time to call the patient up and have a look and see if everything's working all right. Are there any problems with the device or so on? So just for you to monitor whether the patient is actually going through the treatment as you prescribed. That's pretty much it. You can also change some settings, but I'm not going to go into that now. And an important thing to note is that you have an about page here, which is just a brief overview of what I've just described. So this is down here at the bottom of the screen. And an FAQ, so that is where you'll find all the answers to the commonly asked questions if there's anything that you wonder how you do certain things within the portal. Hope this tutorial helped, and be sure to also check out the one on how to use the app so that you can teach the patients how to use it when they come to your clinic.